Good morning to everyone, to Lázaro Manuel, who joins us today, to our sign language interpreter, and good morning to everyone tuned in to this briefing. We start today's press conference with the unfortunate news of the death of a patient with COVID-19 yesterday. The patient was a 71-year-old male from the province of Ciego de Ávila and the municipality of the same name. He suffered from some pre-existing medical conditions and began to develop symptoms on September the 5th. The following day, September the 6th, he was admitted to hospital. Given his clinical profile and following some complications, he was transferred to the intensive care unit in Camagüey's military hospital on September the 8th, despite the fact that the patient was from Ciego de Ávila. He spent 7 days in intensive care, during which his clinical profile continued to deteriorate. He had to be intubated and was administered specific treatments. However, unfortunately, yesterday he suffered cardiorespiratory arrest from which he could not be revived and died. We offer our condolences to his family and friends. We are deeply saddened by this patient's death, especially as we do all we can to ensure that situations like this do not occur. But COVID-19 is a virus with many associated complications, which can ultimately be fatal. Today, 1,783 people are hospitalized in Cuba. 62 are under observation. There are 1,087 suspected cases and 634 confirmed active cases. Yesterday, we processed almost 8,000 samples, 7,939 in our various molecular biology laboratories. 2,310 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 930 in Havana's Hygiene, Epidemiology and Microbiology Center, 810 in Villa Claras, 379 in Santiago de Cubas, 564 in the Genetic Engineering and Biotechnology Center Lab, 537 in the Manuel Fajardo Hospital, 458 in the Molecular Immunology Center, 451 in the Hermanos Almahedas Hospital, 386 in the Civil Defense Laboratories, 308 in the Fructuoso Rodriguez Hospital, 279 in the Naval Hospital, 229 in the National Center for Genetics, and 298 in the ICA laboratories. Of the 7,939 samples processed, 73 tested positive for COVID-19. This brings the total number of samples processed in the entire country since the pandemic began to 508,224, of which 4,876, or 0.96% of people, have tested positive for the virus. As I always mention, samples from all of the country's territories were tested. 120 from Pinar del Rio, 110 from Artemisa, 5,401 from Havana, 247 from Mayabeque, 248 from Matanzas, 258 from Cienfuegos, 158 from Villa Clara, 174 from Sancti Spiritus, 697 from Ciego de Ávila, 104 from Camagüey, 110 from Santiago de Cuba, 90 from Guantánamo, and so on and so forth from all of the country's territories. Of these 73 positive cases diagnosed yesterday, 50 are Cubans and 23 are foreigners, all of whom are Indian construction workers. 70 or 95.9% of the 73 positive cases diagnosed yesterday are confirmed case contacts, the majority of whom had already been traced and isolated. This means that 89.6% of all diagnosed cases in Cuba had contact with someone who had previously tested positive for the virus. Of the 73 cases diagnosed yesterday, the source of infection linked to 3 is yet to be determined. Therefore, the source of infection in 72 cases reported over the last 15 days is still being investigated. Yesterday, no one to have tested positive for the virus contracted it abroad, for a total of 434 imported cases to date. Of the 73 diagnosed cases yesterday, 50 are male, for 50.1% of all cases, and 23 are female, representing 49.9% of all diagnosed cases on the island since the pandemic began. 52, or 71.2% of these 73 cases yesterday were asymptomatic at the time of testing. Overall, therefore, 59.1% of all positive cases on the island since the pandemic began have shown no symptoms at the time of testing. And this figure rises to 61.8% of confirmed cases over the last 15 days. By age group, 6 positive cases diagnosed yesterday are under the age of 18, for a total of 497 children or pediatric cases to have tested positive for the virus in the country. Of these, 439, or 88.3%, have recovered from the virus and been discharged from hospital. Meanwhile, 36 people to have tested positive for the virus yesterday are between 20 and 39 years of age, 27 cases are between 40 and 59, and 4 are over the age of 60. Of these 73 cases diagnosed yesterday, 47 belong to Havana, 19 to Ciego de Ávila, 4 to Artemisa, 1 to Mayabeque, 1 to Matanzas, and 1 case to Sancti Spiritus. Of the 73 autochthonous cases diagnosed yesterday, the 4 from Artemisa belong to the municipalities of Artemisa with 1, Candelaria 1, San Antonio de los Baños 1, and San Cristobal with 1 case. The case from Mayabeque belongs to the municipality of San Jose. The 1 case from Matanzas belongs to the municipality of the same name. And the other case from Sancti Spiritus belongs to the municipality of Yaguajay. The 19 cases from Ciego de Ávila belong to the municipalities of Ciego de Ávila with 8, Morón with 6, Baragua with 4, and Venezuela with 1 case. The 47 cases from Havana belong to the municipalities of Regla with 25, 23 of whom are the Indian construction workers, 10 de Octubre with 7, Guanabacoa and Arroyo Naranjo with 3 each, Cotorro, Boyeros, La Lisa, and San Miguel del Padrón with 2, and Cerro with 1 case. To summarize, of the 4,873 people who have been diagnosed with the virus thus far in Cuba, 634 are active hospitalized cases. 617, or 97.3%, are clinically stable. Yesterday, 1 person died as a result of the virus, meaning that the COVID-19 death toll on the island now stands at 109, with a mortality rate of 2.24%, lower than the global rate of 3.16% and regional rate, which stands at 3.43%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 12 people were discharged from hospital, 6 from Ciego de Ávila, 3 from Havana, 2 from Artemisa, and 1 from Camagüey. This means that to date, 4,131 people, or 84.8% of all confirmed cases in Cuba, have recovered from the virus. Today, 5 patients being treated in Havana, Ciego de Ávila, and Camagüey continue to be in a critical state. 12 patients in hospitals in Havana, Camagüey, and Holguín are also reported as serious. Yesterday, 2 new patients joined the group of those reported as serious, 1 in Havana and another in Holguín. 1 patient from Havana passed from serious to closely monitored. Another, also from Havana, passed from closely monitored to serious, and 1 of the critical patients yesterday sadly died. This is the situation in Cuba. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 260,412 people were diagnosed with the virus, for a total of 19,309,546 confirmed cases since the start of the pandemic. Yesterday, 4,184 people died of the virus, for a total of 928,890 COVID-19 fatalities, and a mortality rate of 3.16%. The region of the Americas, which accounts for 51.23% of all cases worldwide, reported 82,804 new cases yesterday, for a total of 15,018,149 people to have been diagnosed with the virus. Meanwhile, 1,724 people died of the virus in the region yesterday, for a death toll in the Americas of 515,584, and a mortality rate of 3.43%. The United States continues to top the list of countries worst affected by the pandemic, with 6,554,820 confirmed cases and 194,530 COVID-19 fatalities. India follows with 4,930,236 cases and 80,773 fatalities, with 1,054 reported yesterday. Then comes Brazil with 4,345,610 confirmed cases and 132,006 fatalities. From the Americas, after the United States and Brazil, comes Peru with a high number of cases, 729,619, of which 4,241 were diagnosed yesterday. Then Colombia, Mexico with the highest mortality rate in the region, standing at 10.6%. Then Argentina, Chile, Canada, Bolivia, Ecuador, also with a high mortality rate of 9.19%. The Dominican Republic, Panama, and Cuba, which occupies 21st position in the region. This is the information we have on the behavior of the pandemic in Cuba and the world.